Hello guys, Dharma here. So today we are going to discuss about the topic of orthopedics, that is classification of fractures, right? So what is fracture? So the simple definition of the fracture is break in continuity of the bone, right? So here you can see that there is a break in continuity of the bone. So it will divide the bone into two fragments. First is proximal fragment and the second is distal fragment. And this is a fracture site, right? So it is generally a break in continuity of the bone. Now classification of fracture. So why classification is required? So the classification is required to rule out the prognosis and to assess the severity of the fracture, right? And it will also decide the treatment plan. So first, classification on the basis of etiology, like which are the responsible causes of fracture. Second is on the basis of displacement, whether the fracture fragments are displaced or undisplaced, right? So it is related to the position of fragments. Third is on the basis of relationship with external environment, whether it is a open fracture or a closed fracture. Fourth, on the basis of complexity of treatment, whether the simple treatment is required or complex treatment is required. Fifth, on the basis of quantum of force causing fracture, like whether it is a high velocity trauma or a low velocity trauma. Sixth, on the basis of pattern, right? Now, first, on the basis of etiology. So, these are some causes which will cause a fracture. First is traumatic fracture, which is resulting from any traumatic injury like a road traffic accident, right? So the fracture, so the bone will be totally normal, but the fracture will occur due to any traumatic events, which will cause a break in continuity of the bone. Second is pathological fracture, so which is occurring due to the presence of any pathology in the bone. Let's say, for example, tuberculosis of a bone, which will cause a weakening of the bony architecture and result in a pathological fracture. So in this figure, you can see a X-ray of hip showing destruction of bone, which lead to the pathological fracture through weak portion. Third is stress fracture. So it is a special type of fracture which is resulting from a chronic repetitive injury, right? So this type of fracture will not be visible on the X-ray, and the fracture will occur within the bone, bony trabecula, right? So it is often present as a pain only, which is a deep type of pain and not visible in X-ray. Now on the basis of displacement, so the whether the fracture fragment is undisplaced or displaced. So in undisplaced, the fracture fragments will remain in its place. Normal shape of the bone will be maintained in presence of fracture, right? And there is no displacement of fragments. Second is displaced fracture, in which proximal and distal bone fracture fragments are displaced from its places. So it is further classified as a shift, angulation and rotation, right? So these are the types of displaced fracture. First is shift, in which one fragment will shift in relation to the other fragment. Second is angulation, so there is a formation of angle between two fragments. And the third is rotation, right? So the one fragment or both the fragment will rotate in its opposite direction, like one fragment will rotate in relation to the other, or both the fragment will rotate in opposite directions, right? Now on the basis of relationship with external environment, first is close fracture. So so in this type we have to check whether there is any soft tissue injury related to the fracture or not. Like first is close fracture, so there is no break in continuity of the skin. The fracture fragments remains inside the skin, right? So it will appear as only a swelling, redness, okay, and there will be a no break in continuity of the skin. Second is open fracture, which is also known as compound fracture. So in this fracture with the break in the overlying skin and soft tissue, right? So there will be a extensive soft tissue injury along with the fracture, and it will communicate with the environment. So the bone fragments will directly communicate with the environment, and it has a higher risk of infection due to the exposure to the environment, which is further divided into internally open fracture. So in internally open fracture, so the sharp end of the fracture fragment will pierce the skin and will come out by penetrating the skin. So we can say that it is from within the skin. Second is externally open fracture. So let's say any external agent which might be a very sharp agent which will lacerate the skin and cause a fracture, right? And it will expose the fracture fragment to the environment. So we can say that it is an externally open fracture, which is open from outside. Yes, so here is a figure of a closed fracture and a open fracture. So in closed fracture, you can see that the integrity of the skin or soft tissue is maintained, while in open fracture, the fracture fragment is penetrating out from the skin, right? Now on the basis of complexity of treatment, so the simple fracture will require a very simple treatment, easy to treat, because there will be only a two pieces of the bone, right? For example, in transverse fracture. Second is complex fracture, in which there will be a multiple pieces of the bone resulting from any compressing forces or a crush injury, right? So it is difficult to treat. Lot of orthopedic skills are required to treat such type of fractures, which involves the fixation, right? Internal fixation, external fixation, screw and all, which is generally seen in the comminuted fracture, right? On the basis of quantum of force causing fracture, first is low velocity injury, that is resulting from a fall, and the second is high velocity injury, example road traffic accident, severe soft tissue injury and fracture, right? Now on the basis of pattern, so first is a transfer type pattern fracture. So transverse fracture, in transverse type of fracture, fracture line will be perpendicular to the long axis of the bone. So here you can see that the fracture line is perpendicular to the long axis of the bone. Second is oblique, fracture line will be oblique, right? So here you can see the fracture line is oblique in oblique type of fracture. Third is spiral, so the fracture line runs spirally in more than one plane, right? Here you can see that the fracture line is moving spirally in more than one plane, like a spiral. Fourth is comminuted fracture, in which there will be a multiple fragments resulting from a crushing or a compressing force, right? Here you can see there are multiple fracture fragments, difficult to treat. Fifth is segmental fractures, two fracture in a one bone, right? Two fractures in a one bone at a different levels. So here you can see a segmental fracture, two fractures at a different level in a single bone, right? Yes, so it was all about the classification of fracture. Thank you.